for joining our webinar, treating both the biological and sociological aspects of mental illness. I'm excited to introduce our presenter today, Dr. Rishav Koirala. Dr. Rishav Koirala is a consultant psychiatrist and a researcher. He is currently pursuing his PhD on study of health outcomes of trauma in terms of human behavior changes and biochemical markers from University of Oslo, Norway. He is also involved in research in traditional healing and mental health, substance abuse, psycho-oncology, and other topics related to mental health. He established Nepal's first Psycho-oncology Clinic at Nepal Cancer Hospital, and he is the executive manager of the Brain and Neuroscience Center. He has worked as the focal person for mental health in World Health Organization for Nepal, and is the associate professor at People's Medical College and advisor for the Transcultural Psychosocial organization. He held the post of joint treasurer of the Psychiatrists Association of Nepal and has worked in several remote areas in promotion of community psychiatry. Thank you so much for joining us today, Dr. Koirala. You're welcome to get started whenever you're ready.
Thank you. I have a presentation made. I'll be sharing that. Yeah. So today I'm going to talk about the biological and sociological aspects of mental disorder. I would like to mainly focus on the sociological aspect, as most of us are aware about the biological aspect, and previous webinars have focused on those already, though I'll be touching about it too. And all the statements that I speak represent my own learning and experiences. I might not be right in each and every aspect and might not represent each and every individual, but I'm talking in a general sense. Almost all of my comments are based on some research data and experiences that I have had, which I can provide evidence. To start with, before discussing about mental illness, different point of view, discussing about mental illness and seeing it in a different point of view, we need to talk about human behavior. Mental disorder is an illness where the diagnosis is based on symptom cluster consisting of emotions and behavior of the person. When we talk about behavior, it is always influenced and defined by the society, what is normal and abnormal. So understanding of normality is of great importance when we want to address our issues of mental illness. So these are some of the references that I've used for my presentation. There can never be a standard definition for normality of human behavior because it has such a wide variation, and it differs from place to place, time to time, and so on. So rather than going exploring the normality of human behavior, I would like to mention some points given by George Valiant, which are like cautionary steps to be taken while defining normal mental health. And we should also realize that when we talk about normal mental health, we are not talking just about the absence of illness or mental illness. So several authors have tried to describe normal mental health in different ways, but almost every definition has some flaw. So instead, what we'll be dealing is we'll be talking about how we should approach or see what normality in mental health is and what are the cautionary steps to be taken. First, we need to understand that average is not healthy. By this, what we mean is, for example, when we talk about eyesight or even average weight of a normal population, the average weight does not come to be healthy, or the average eyesight does not come to be healthy. So even in mental health, the average person may not have a normal mental health. Everyone goes through some issues, shortcomings, ups and downs in their life, and some problems with their psychological problems in their life, on and off. So we should not be expecting a person to have, on an average, a person to have a perfect mental health. So another point is normality of human behavior also changes according to society, culture, and historical timeline. In Nepal, for example, having a trance-like position, trance and position-like spell might be a religious act, and that is taken positively by the society, but the same thing would be viewed in a different way in Europe or US. So I'll elaborate more about this in later in the presentation. So we should also consider in the particular consider if the particular behavior is a state or a trait. That is, a person, for example, if a person has an anxious personality and has learned to live in an anxious way throughout his life, that the anxiety, the daily anxiety with which he is living or coping with and running a normal life may be quite normal for that person. But if another person who is usually calm and relaxed has the same amount of anxiety, then that might not be normal for that person. Another important thing to keep in mind is when we define normal behavior, are we describing the context of the are we describing in context of the values that we carry, like for example competitiveness or scrupulous neatness might be a very healthy thing, a very important normal thing or needed thing in one society or culture, while it might be seen as a personality disorder or being too much obsessive in another. So all these things, all these points should come in our mind when we tend to see or even describe mental illness. And we should also understand that almost all of the times normality is defined by those who regard themselves as normal. So we human beings were never meant to be same. All of us are different. We carry different components within us of what is normal or abnormal. So these components play the creation of psychological issues. These abnormal components play help or they precipitate the issues in our life. So in my learning, rather than focusing on abnormalities and normalities, we should focus on those behavior or those processes that might cause harm to us or ourselves or others. For example, like if we have suicidal thoughts or suicidal plans, that is one of the important things that needs to be addressed, because obviously that would lead to a major harm in our life. Similarly, for chronic disturbed sleep or constant low mood, if that's harming us, we need to address that. So more focus should be on the suffering. Now, coming back to viewing mental illness, seeing an illness in different point of view gives us different understanding. So the wider our point of view on seeing a behavior or actions or illness, or issues created by illness, we'll have more solution to it and we'll have more approaches to it, hence making the sufferer's problem more comfortable. These points like, so another important thing is like every expert has their own point of view, whether it's a social scientist, a psychiatrist, a psychologist, or biological researcher. What we should understand is nothing is totally right and nothing is totally wrong. We should get it and take the best points from each point of view, and these points cannot be seen as black and white. One does not exclude the other, but they're like yin and yang. One complements or like connects with the other. So we should tend to see mental illness in each and every perspective, and it is not an output of like we should also understand that mental illness is not an output of just a nature or gene alone, but or just an output of nurture or society alone, but it's an output of everything combined. So approaching mental illness in that and in different point of view obviously will help. And what happened was like in 1970s, a lot of advancement was made in the biomedical model with the discovery of medicine, psychotropics, which really changed the perspective how mental illness was treated, with new discoveries related to brain and so on, even genetic exploration. But that dominated the whole approach to mental illness. So around 1977, what George Engel and John Romano did was they proposed a biopsychosocial model of mental illness. And with that model, they said that um, the whole field of mental disorder should be approached in a humanistic way, viewing mental illness, mental disorders uh, as an outcome by a biomedical way point of view also. But along with that, we also need to see it in a different angle, in a psychological way, the psychological makeup of the person, as well as the sociological way. So I'll be discussing about the biological and sociological aspects a bit before I give some examples. Among the three aspects, as mentioned earlier, biomedical has gained the most advancement, and it has also contributed quite a lot for the exploration of mental illness, which cannot be neglected. The advances in the field of medical science, whether it's in the form of genetic exploration, is huge. The Consortium for Genetic Studies for Mental Illness is the largest in the world, which is like the data is contributed by all the researchers all over the world. So it's a huge data that we are gaining and gathering. There has also been a lot of exploration in biochemical markers such as cytokines, other proteins, which we are exploring to see if we can have some more valid diagnostic criteria rather than just symptoms or behavioral cluster. So, and but the biological one of the huge biggest contribution is the discovery of psychotropics. Now, the benefit of biomedical approach is that it takes away blame from the patient. Before, the blame was totally on the sufferer. And in societies, in many societies, even in Nepal, it was regarded as mental illness was regarded as an outcome of sin of past life or current life and so on. So the person who was suffering was blamed for everything. Then this has changed with the advent of or the development of biomedical approach or the discovery of medicine. Now approaching sociological aspects. So in the sociological aspect focuses on impact of social circumstances on mental health and illness. Sociological approaches share the idea that mental health and illnesses are not just qualities of individual. They also see it in a macro level, and they suggest that it also stems from various aspects of social circumstances where the sufferer is, or the person who is suffering from psychological distress is going through. And it has two major approaches. One approach being how processes such as life events, traumatic events, social conditions, the upbringing, social roles, social structure, and cultural systems of meaning affect the state of mind, how they help in creation of the mental illness. One approach being that. The other approach, equally important approach, is they also explore how the varying social values towards mental health and illness shape the reaction to mental troubles, like how the society sees the whole system, and what impact that the point of view has on the mental illness or on the sufferer is also approached by the sociological aspect. Some of us might have heard about epigenetics. Epigenetics is about how epi comes from two words, one being above, epi means above, and the other portion being genetics. So what it represents is that even the environment, the culture, the surrounding, and everything that a person goes through, even the experiences the person goes through, that also brings a change in genetics. That also brings changes in our genetic level. Hence, that has an impact on the formation of or the outcome, that is mental illness. So the sociological aspect should not be taken lightly because it has very deep ingrained values on the whole process of creation of mental illness, as well as how it is dealt with. The benefits of sociological approaches is like it sees the whole system, mental health and illness in a macro level, and it addresses mental health issues through societal level planning, highlights the factors such as accessibility, quality, type, and amount of healthcare that is available to the people, and how it is important, how without that the whole approach to mental illness can be wrong or incomplete. And it also addresses not only the need in treatment, but how the government, the society should play their active role in the elevation of the symptom of the sufferers. So with this background, um, I would I would like to discuss few examples where mental suffering or behavioral problems can be seen through different perspectives, both medical and sociological. One example that everyone usually uses is attention deficit hyperactive disorder, ADHD. To tell you a bit about ADHD, in Nepal, ADHD is very rarely diagnosed, very rarely diagnosed, and adult ADHD is almost not diagnosed at all. Um, One of the main reason is that the first line drugs, like whether it's methylphenidate, Ritalin, or dextroamphetamine, they are not approved in Nepal by our drug federation, or the government has not approved it. It's a long process, so it has not been approved. So how we have to see is like the whole illness is seen in a different angle in Nepal, and another important thing is uh, the need to address ADHD has not been as important as in the West for Nepal. It's because it's because of the structure of the society in Nepal. All of us most of us grow in joint family with, were raised by also raised by our grandparents. Even if our parents are busy or at work, and the kids are seen by the grandparents, and they are taken care of by the grandparents. So even in ADHD, we all know that children are a bit hyperactive. They are seen as a bit naughty and difficult to control. So when there are people in the family to take care of those children, then it doesn't become a big issue. But in the West, where the children are grown up by like raised by the in a singular family or nuclear family, where both the parents are working, it's really difficult to raise kids with ADHD. So their needs and they need to seek help in different way. And one mild and moderate cases, for example, I also treat ADHD in Nepal, like by other modalities and some other medicine, whatever is available, but only if it's in a serious level or severe level. But mild and moderate levels are not treated. So this shows how the whole structure of the society changes the way of addressing so-called mental illness or disorder, and or behavioral issues. And we all know that the high rates of medicine used in US and other parts of the world where ADHD is quite commonly treated. So I hope this gives a different perspective to the listeners. Now, another example would be dissociative or convergent disorder, which was previously known as hysteria. It's quite common in Nepal. Mostly in rural areas. What we should understand is like in countries like Nepal, where the medical system of treatment is quite comparatively new. The whole system, our whole system was also had mental illness before the advent of, or before the introduction of Western medical treatment in Nepal, and it has been there since ages, like centuries. That had been managed in different ways. Probably that was not managed so well in some aspect, but some majority were managed in one way or the other using the local methodology. So mild and moderate symptoms of mental disorders such as dissociative disorder anxiety, depression, they were treated by traditional healers, mainly using faith healing or local herbs or Ayurveda or other modalities. And we have evidence to support that these modalities also play a role in elevation of symptoms, help the sufferer, and a lot of research has been done in some of which I have also been involved. So with this, I would like to emphasize that a different perspective for mental illness also has its own way of dealing the issue rather than just using the psychotropics. So it should also be considered, it should also be taken in practice or taken in value when we approach mental illness. The same modality might not be helpful for the Western society, but we should not exclude this modality for the Eastern or our society. And the West might also have similar ways, like the complementary healing has been like, or complementary medicines are in rise again, in even in the West, in US too. So we should explore, it's always advisable to explore those two which have evidence and which have we should also think about the side effects too, like the negative aspects too. And if those healing modalities has really helped, then I think that should also be taken into consideration. Now, talking about perspective, I would like to share with you a photo that of a person, like this guy, I met him in a very rural area of Nepal. I had gone there to give a training on mental health to paramedics, and from there I heard that a guy, like male, like he was um, tied to a log for 18 years because of his psychotic symptoms. And I was like, I was really shocked. It was a new experience for me too. And I thought, initially I thought it was quite an inhuman act of dealing with mental illness. And I was ready to help. I went there. It was farther from that rural area. We had to hike. We had to take initially a motor drive on a motorbike, then hike, and then I reached to that place, the home of that person. And when I explored the history, I came to know that when the symptoms started 18 years back, the person had started running here and there, had a very disorganized behavior that injured him. The person got injured because of his behavior. The family members, he was already married at that time, and the family members took him to different places. They took him to traditional healers, they took him to local health posts where the concept, the paramedics or the health professionals, they were not even aware about mental illness so much. They did not know how to treat mentally ill people. So they tried every modality of um, help that was possible they could search for. And finally, when they could not heal that person or control his behavior, so they tied him to a log, and and that was done to take care of him so that he would not hurt himself, he would not harm himself. And they took care of this person who was not productive, who did not maintain self-care for 18 years. They, and in that perspective, I see it as a very human act. So they used every possible way to help him. So that person, I met him and I started him on antipsychotic, and on the next visit he was a completely different person. I lost the next photograph. He came himself along with his family member to the health post. He changed. So what I am um, trying to share is that all forms of help is should be valued. The psychotropics did, the antipsychotic did change the life of this person, but if the family hadn't taken care of him, tied him to the law, fed him for 18 years, you would not have access to that antipsychotic, which he recovered significantly. So this is another example, is the presentation of psychological distress or mental illness. It's quite different in different culture, in different part. In our society or in many society where the concept of mental illness as a whole, because here, before a decade back in Nepal, being mentally ill meant literally being like having psychosis. Even anxiety, depression were not even considered as an illness, and so people did not have a way of presenting those kind of stress. Like in the US, a person might go to a psychiatrist and say, doc, I'm feeling low, I'm depressed, or they might say, I'm getting really anxious. But things were not like that 10 years back, and even not like that in many parts of Nepal. So they present their psychological suffering, or their depression or anxiety, as different physical symptoms such as chronic headache, back pain, tingling sensation. Almost each and every patient I see in my OPD come along with this kind of symptoms. They also have this kind of symptoms. So once, when I was conducting um, health camp, mental health camp in a rural part of Nepal, initially we announced it as being a it announced it as a mental health camp for people having mental health issues. None of the people came because of the stigma, also, and many people did not know that they had mental health issues. So since very few participation was there, we developed an idea to change the title of the whole health camp, and we said it was for chronic headache as well as mental health issues. So and things changed. The next day there was quite a number of patients. We took a lot of time to we were like really overloaded by patients, because they came with chronic headache that was not addressed by using analgesics and other mode of treatment. And most of the patients, they had some issue with anxiety and depression. So we should, with all this, I want to say that we should see mental illness or behavioral problems or issues in a wider way of viewing. And what our priority should be is not about the labeling illness, which is also, labels are needed to carry over prescriptions, to share about illness, to give an idea about illness. But the treatment or health should not focus on those labels, but rather on the suffering of the person. And that should be the priority, and that should be the approach of treatment. Social support, involvement of family members in the treatment, as I see, is of utmost importance. A person will not be able to fight through mental illness without social support or involvement of family members on an average. It's almost impossible, because um, as I discussed earlier, it's mental illness or disorder is not a, a issue that a person has. It's an issue that involves each and every person in the society, and even the family members also. So, and another point is, like I mentioned earlier, we should not be hesitant in seeking help in different approaches. We should not be hesitant in seeking help in using medicine as well as other approaches. And local modalities of treatment should also be encouraged. A lot has been done, like involvement of um, people with disorder in management plan has been a new step. WHO has also taken new steps, really applaudable steps, by involving the sufferers or the patients. And a lot of by exploring the culture, understanding culture and social background, a lot of methodologies has been developed to help with stress. For example, mindfulness meditation, which is quite popular right now and is also in a lot of guidelines, whether it's American Psychiatric Association guidelines or British Psychiatric Association guidelines. A lot of guidelines include mindfulness meditation, which was a part of um, it is derived from Vipassana, a meditative practice that was taught by Buddha. And so all using this and other forms of um, help, such as yoga and Yoga also helps in fighting with mental illness to some extent. It acts as an ancillary support. So these all things and new modalities should also be explored, in my point of view. So this is it. Um, with this, I end my presentation. I'm open for questions.
Okay, great. Thank you so much for that presentation. It looks like we have time to do a Q&A, so I will get started with some of the questions in a moment. And just a reminder, if you're joining us on Facebook Live, you can just type your questions in the comments. And if you're joining us on Zoom, you can send any other questions you have through the chat. So for our first question, someone asked, do you know of any alternative medical treatments such as meditation that may be helpful for bipolar disorder or depression?
I practice psychiatry, and I practice Western psychiatry as my core practice, though I include other modalities. I'm not directly aware about other treatment modalities for bipolar, but I've seen I've seen in my practice that use of exercise has dramatic effects on any kind of mental illness. Like regular exercise really helps. It helps to decrease the dose of medications or even control so many symptoms. And exercise directly improves sleep quality, which has a very important role in the improvement of the psychological distress related to bipolar or even depression. So that would be my recommendation. Apart from that, I'm not aware about other modalities of treatment for bipolar.
Okay, thank you. That's really great to know. So moving on to our next question, someone asked, do you know why it is that hysteria and dissociative disorders are more common in rural areas, specifically in Nepal, but also just in general?
Oh, one hypothesis, one explanation would be like it's a prism. How I describe dissociative disorder is a person has both conscious and subconscious mind. So when a person is not able to deal with the trauma stresses through their conscious mind, their subconscious mind gets quite distressed. So what the subconscious mind does is it's not able, the subconscious mind, I mean your mind, which helps you drive a motorcycle or while you cycle, you don't have to think about using the pedals, or you don't, it comes automatically in the handling of the brakes and everything, and that kind of stuff is run by subconscious mind. That's how I explain to my patient. So when stress is not handled well by the conscious mind, the subconscious mind gets trouble, and it has to express it tends, it searches for a way of finding out expression or expressing its stress. So it expresses the stress in the form of it converts the stress into physical complaints, or whether it's dissociative trance or fainting, pseudo seizure like symptoms, and it expresses in the form of dissociation. So it's more about, with all this explanation, it's more about expression of stress. And when in rural areas people don't have good way of expressing their mental stress, and it has been a cultural thing also, that they tend to express their stress through all this way of expression. So I think people being more aware in urban areas about mental health and directly expressing their stress, they have less use of their dissociation as a defense mechanism to deal with stress than those with rural areas. Therefore, it's more common in rural areas. I hope I explained it. The question. The question. Yeah.
Okay, great. Thank you. Yeah, that made perfect sense. So thank you for explaining that. So for our next question, I know you talked a little bit about how social support is really important for treating people with mental illness. And someone asked if it's possible to for recovery for people who don't have social support or family support, and if it is possible, what are the next steps for helping someone in that situation?
Yeah, social support means an organization like this is also a really good example of social support. We can find it in different forms. We should explore it because it helps us, it guides us, and sometimes I think there might be, for example, why I am talking about social support is even social support also comes in different forms. Here in Nepal, there is no support by the government, or there are no such kind of facilities, and even an organization like Bipolar Foundation is not present in Nepal. So, but we have a different modality of social support, whether it's family members or even we have a different connection over here. Like the way I deal with my patient, it's more of there is a different bonding, how we approach patient and how patients approach doctor. It's not just a profession. It's more about a different system. There's a different connection which might not be present in a more capitalistic society like US. And so, but there are other modalities. So I think exploration of other forms of social support, for example, how if the government is providing some different programs, I think joining those programs would be a very beneficial idea for those who lack other forms of social support.